Hi doctor, my name is Dineshwaran. My matrix number is 1811515575. Today I am going to present about the medical ventilators. There are two parts which I am going to present today. For the first part, it is about the overview and operation of the medical ventilator. So for the second part, it is about the electrical motor and drive that have been used in the medical ventilator. First of all, what is ventilator? In general, ventilator is a medical device that support or taking over the breathing process and pumping air into the lungs. It is also known as the breathing machine. Ventilators are mainly used in hospital and transporting systems such as ambulance. In some other cases, it is also known to be used in the home treatment. The ventilator plays an important role in saving people's life both in hospital and ambulance. The ventilator often to be used in short periods such as during the surgery or during the treatment for serious disease or other conditions that affecting the breathing process. The people who are in ICU also need the support of the ventilator. Before COVID-19 became a pandemic, the need for the ventilator was one of the most common things for the people who are having treatment in the ICU. As the COVID-19 became a pandemic, the demand for the ventilator was increased as the COVID-19 patient needs the ventilator as the breathing assistance. The simple operation of the machine is that the ventilator gets the oxygen into the lungs and remove the carbon dioxide from the lung. This will make the breathing process become more easier for the patients. The ventilator uses pressure to blow air into the lungs. This pressure is known as the positive pressure. The amount of oxygen that the patient receives can be controlled by the monitoring system that are connected to the ventilator. If the patient condition is particularly fragile, the monitoring system is set up to send an alarm to the caregiver indicating there is a increase of air pressure. The operation of ventilator can be done by following few steps. The first step is that the ventilator blows air with oxygen through tubes into the patient airways. The air flowing into the patient are passing through the tube which warms and moistens the air. Later on, the air will flow into the patient's windpipe and enter the lungs. At last, the exhaled air will flowing away from the patient by following the reverse process and enter into the ventilator. So these are the explanation that explain on how the ventilator are working. As I mentioned earlier, for the part 2, I am going to discuss about the electrical motor and drive that have been used in the medical ventilators. So brushless DC motor is the best choice for the air breathing equipment such as the ventilator and respirators. The brushless DC motor is permanent magnet synchronous electric motor which is driven by the direct current. It accomplished electronically controlled by the commutation system. The brushless DC motor consists of stator, rotor, winding, bearing and the permanent magnet. So that's all from me. Thank you.